Hello, Study Nurse IQ family. Welcome back to the channel. I'm Ginny, and this is part 2 of our deep dive into coronary artery disease, or CAD. In our last video, we covered what CAD is and how it develops, that dangerous buildup of fatty plaques in the coronary arteries. Today, we're shifting gears into what nurses do best: interventions, patient education, and medication management. If you missed part 1, check it out on our YouTube channel, Study Nurse IQ, where we also included a 3-question Nclex quiz to test your foundation. Now, let's build on that knowledge and dive right in. And remember, stay with me until the end for fresh Nclex-style questions to lock in your learning. Part 1, Nursing Interventions. Education is power. As nurses, our biggest role with CAD patients is education. We are not just treating disease. We're empowering patients to prevent it from progressing into something life-threatening like a heart attack. Let's focus on the areas that truly make a difference. Lifestyle modification. First, lifestyle changes are the cornerstone of prevention. Smoking cessation. Smoking is one of the hardest habits to break, but also one of the most damaging to the heart. It causes vasoconstriction and injures the artery walls, creating the perfect surface for LDL cholesterol to stick and form plaque. As nurses, we must provide resources and encouragement to help our patients quit, because every cigarette stopped adds time to their life. Diet and weight. Next, diet and exercise go hand in hand. Encourage a heart-healthy diet that's low in saturated fats, refined sugars, and sodium, but rich in fruits, vegetables, whole grains, and lean proteins. For patients with obesity or high BMI, steady weight loss can dramatically reduce their risk. Pair this with moderate, regular exercise, such as brisk walking for 30 minutes a day, 5 days a week. Monitoring and when to seek help. Monitoring helps patients take control of their own health. Vital signs. Teach them how to monitor blood pressure and heart rate at home and to keep a log to share with their healthcare provider, especially if they have hypertension. Chest pain. If they have nitroglycerin prescribed, they must know exactly when and how to use it. Nitroglycerin patient education, step by step. At the first sign of chest pain, sit or lie down, take 1 nitroglycerin tablet or spray under the tongue, wait 5 minutes. If pain is still there after 5 minutes, take a second tablet under the tongue. Wait another 5 minutes. If pain continues after the second dose, take a third tablet under the tongue. Wait another 5 minutes. If pain still hasn't gone away after the third dose, 15 minutes total, call 911 immediately. Do not drive yourself. The ambulance team can begin life-saving treatment right away. Teaching tip. Always remind patients to store nitroglycerin in its original dark glass bottle, away from heat and light, and replace it every 6 months once opened, because it loses potency quickly. Procedure preparation. Now let's connect this knowledge to what happens before key cardiac procedures. Heart catheterization. Patients need to be NPO, nothing by mouth, and checked for allergies to shellfish or iodine since contrast dye is used. This procedure is done with moderate sedation, so reassure them it's not painful, but that they'll need someone to drive them home. Stress test. If they're scheduled for an exercise stress test, make sure they wear comfortable walking shoes and clothing. Also, beta blockers are often held before the test so the heart can respond naturally to stress. Lipid profile blood draw. For accurate cholesterol results, they should be NPO for 12 hours, with only sips of water allowed. Part 2, Medications, the anti-CAD arsenal. Let's talk medications. Our main goal is to prevent plaque progression, reduce clot risk, and decrease the heart's workload. Antiplatelets. These prevent platelets from sticking together and forming clots. Aspirin, the classic choice. Watch for signs of GI bleeding such as dark stools or abdominal pain. Plavix, clopidogrel, common after stent placement to prevent stent thrombosis. Critical nursing tip. Monitor for TTP, thrombotic thrombocytopenic purpura, a rare but deadly reaction. Look for signs like confusion, renal failure, fever, bruising, and anemia. If surgery is planned, Plavix must be stopped 5 to 7 days prior to reduce bleeding risk. The provider may temporarily switch them to a different anticoagulant. Nitrates. These medications open the arteries and improve oxygen delivery to the heart. Nitroglycerin, usually taken sublingually or as a spray. The 3-dose rule. Take 1 dose at the onset of chest pain. If pain persists after 5 minutes, take a second. After another 5 minutes, take a 3rd dose. And if pain still isn't relieved, call 911 immediately. Critical safety warning. Never give nitroglycerin to a patient who has taken Viagra, Cialis, or Levitra within the last 24 to 72 hours. The combination can cause fatal hypotension. 3 cholesterol medications, statins. Statins are key for controlling cholesterol, one of the biggest risk factors for CAD. What's our goal for using statins? Our goal is to lower LDL, the bad fat, to below 100 milligrams per deciliter, lower triglycerides, and slightly raise HDL, the good cholesterol. Education points. Statins are not a cure. They work best when combined with a heart-healthy diet and exercise. Watch for muscle pain or weakness, a sign of rhabdomyolysis. Check CPK levels, creatine kinase. If elevated, notify the provider immediately. Monitor liver enzymes, ALT and AST, since the drug acts on the liver. 4 antianginal and antihypertensives. These medications reduce the heart's workload. Example beta blockers, they end in LOL. They lower heart rate and blood pressure, reducing oxygen demand. Always check apical pulse for 1 full minute and hold if below 60 BPM. Caution in diabetic or COPD asthma patients, and avoid grapefruit juice, which can enhance drug effects. Example 2 are ACE inhibitors, they end in PRIL. They cause vasodilation, lowering blood pressure and easing the heart's workload. Watch for a dry cough, hyperkalemia, or angioedema. If the cough is intolerable, the patient may be switched to an ARB, like losartan. Now, let's test what you've learned with some Nclex style question. Question 1. A nurse is providing discharge teaching for a patient prescribed sublingual nitroglycerin. The patient should be taught to take 1 tablet and then call 911 immediately if the chest pain is not relieved after which dose. Answer the 3rd dose. Rationale: take 1 every 5 minutes for up to 3 doses. If pain continues after the 3rd, it indicates possible MI. Question 2. A nurse is reviewing a patient's chart before administering a prescribed statin. Which lab value is most important to monitor for severe adverse effects? Answer: CPK kinase levels. Rationale: elevated CPK suggests muscle breakdown, rhabdomyolysis, a life-threatening side effect. Question 3. A patient on Plavix for a coronary stent needs an emergency appendectomy. What is the nurse's priority consideration? Answer: stop Plavix 5-7 days before surgery. Rationale: this reduces bleeding risk during surgery, but the provider will ensure another anticoagulant is used to keep the stent patent. Closing. If this video added value to your nursing journey, please subscribe to Study Nurse IQ and share it with your classmates. You're building knowledge that saves lives. I'm so proud of your progress. Thank you for studying with us, and I'll see you in the next video.